Quick. Good morning, everyone, and welcome to today's Early Childhood Recommendations panel meeting. My name is Cornelia Stevens. I'm the Executive Director of Top Early Learning Centers in Wichita, Kansas, and I have the privilege of serving as the chair for our panel. We'd like to also welcome everyone who is here on today's meeting, and thank you for serving our Kansas children and their families, and our and please note that this is a remote meeting, and so today's meeting materials are posted on the panel meetings website at the Children's Cabinet's website, kschildrenscabinet.org. Panel members, we would like you to clearly identify yourselves when you begin speaking. You can use the raise hand feature if you like, if you have questions or would like to share further, but that raise hand feature is not required. For today's agenda, we have the welcome, which I'm doing right now. We're going to be approving the March agenda, approval of our January meeting minutes. We have a Kansas open forum if we had anybody that was interested in speaking and sharing information with the panel. We'll have several presentations today. We'll learn more about the Child Care Capacity Accelerator Grant, CCL Regulatory Review Update, the Early Childhood Government Summit recap that we had last month. We'll have a tactic work group orientation, early childhood education shared resources, infant mental health endorsement, updates from panel members, bright spots, and then we'll talk about upcoming meetings and then adjourn. So the first action item is that we need to approve our March agenda. So panel members, please clearly identify yourself if you begin to speak and have when you make and second a motion. So first, the March agenda was sent out. May I have a motion to approve the March agenda?
This is Hannah White, and I move to approve the March agenda.
Perfect. May I have a second?
This is Brenda Bandy with the Kansas Breastfeeding Coalition, and I make a second motion.
Perfect. All those in favor say aye or thumbs up.
Aye.
All those opposed, same sign. No opposition. Very good. The January minutes were also shared. Were there any updates or revisions needed to the January minutes? If none, may I have a motion to approve the January minutes as submitted?
This is Marita Saltuna. I move to approve the January minutes.
Okay, may I have a second?
This is Natalie McLean. I'll second.
Perfect. All those in favor, thumbs up. And all those opposed, same sign. And we have none. Very good. So we each month do have a Kansas Open Forum where we invite Kansans to submit comments or speak before the panel. Do we have anyone slated to present to the panel this morning?
We had no responses this month.
Okay. So please know that if you have any comments, questions, et cetera, that you would like to share with the panel, we'd ask you to submit those to the Kansas Open Forum's comment form by 5 o'clock on, we'll have you submitted the Thursday before our panel meeting to share written comments and sign up to share the verbal comments during our panel meeting, this portion of the meeting. And so please, we do encourage, we'd like to hear from you. If in fact you have something wonderful happening in our community, our thoughts or concerns or whatnot that you want to share with the panel. So the first presentation that we have is from Lucas Neese from the Kansas Children's Cabinet and Trust Fund, and he is going to talk about the Child Care Capacity Accelerator Grant.
Thank you, Cornelia, and thank you all for the opportunity to come and present in my new capacity with the Children's Cabinet. It's good to see everybody again, or those that were on the panel last year when I had that privilege of being part of the panel. Hopefully you've already come across the accelerator. We opened the grant opportunity, I think 2 weeks ago, and we have a May 15th deadline. So, but just to have the opportunity to present to this group, the accelerator is a grant opportunity. We've got about $39 million. And the purpose is to help community-based applicants build or make capital improvements that create additional licensed childcare seats. So that's kind of the baseline is for applicants, you have to be creating new seats. There's also an operations portion of the grant, and the operations portion of the grant is actually has a spend down date that is before our capital piece. So our operations grants, we're hoping that folks that have recently added capacity, that they're bringing that capacity online, that they'll apply for those operations grants. So if you know if your center or you know of somebody who's just added capacity, it's just being licensed, please have them look at this opportunity. They'd be a great fit. Thank you. So we've got lots of resources up at allinforkansaskids.org/communities or also /accelerator. I've done 2 webinars now, and the recordings of those are up. There's an FAQ that is being added to all the time. And if you know folks that are looking at this, you're looking at this and you've got questions, please use the technical assistance form that is up at the website. That helps us to generate an FAQ for other folks. So we've got 2 more webinars in front of us, March 31st, so next Friday, and then Thursday the 6th. And we may add more, we can reevaluate, but the goal was to say, well, listen, folks have got to get their applications in. We're going to try to answer questions up front and then give folks time to finish that up. And we anticipate making those awards by the end of June. So really want to get these projects going. And we could be, if folks have invoices that they can turn around for me in July, we could possibly be writing checks in July even. But it will be because this is it's federal money. There's a lot of accountability built in, and so folks are going to have to present invoices, and we will be paying those amounts. We're not able to just write a lump sum payment, for the full award that we would give someone. So got to be adding seats. Applications need to have an identified fiscal agent. So somebody who's going to be responsible for carrying out the project and be in interaction with me. Want to see good community support. That could be resolutions from your county commission, from your city council, and it could be a really good community in action process. We'd love to see that. With that fiscal agent, an identified community champion. That's probably, the fiscal agent is probably the organization, right? The community champion being the person at the organization. And then the 25% project match, that's a minimum. We will not be funding more than 75% of a project. And everything's online at allinforkansaskids.org/communities or accelerated the RFP and the process. We really need folks who are applying because it's a compressed timeline, because the spend down is a compressed timeline. We need folks who are able to show that they can do this, that they have some experience with pretty significant capital projects, if that's what they're submitting. Folks that have experience. So please show that in your application. Be very clear with that. And the application, it's on Kansas Common App. It's pretty exhaustive. So we need project information summary. You've got to be able to show that it's needed and that you're able to carry it out. We're looking for projects that are pretty transformational. And that means different things in different communities across the state, right? If you're in Sedgwick County or Johnson County, a transformational project probably has at least 100 seats. If you are in Trego County, a transformational project may very well have 10 seats, right? We understand that, and we want to support transformational projects across the state in communities of all sizes. But please be thinking about that as you are applying, that we're looking for transformational projects. And I think that probably gets me to the end of my presentation. I really appreciate your time and the work that all of you are doing to serve children and families in the state of Kansas.
Thank you, Lucas. Does anyone have any questions?
This is Maritas. I do have a question. Lucas, on the 25% project match, can you clarify that a little bit for me?
Sure. So if it's a $100,000 construction project, we will not be funding more than $75,000. We do have an in-kind portion to that that folks can kind of explore and submit, and probably want to talk with me in advance. We would anticipate in-kind being, maybe being real estate. It could be other things, but so at least 15% of the project needs to be cash, though, or cash equivalents.
Okay, this is Maritas again. I do have a follow-up project on the awards. The operations side, what if you have a building and you just need a startup for operation?
Yeah, please submit that application.
Okay.
Yep.
Is there a minimum for that or no?
There's not a minimum. We are, it needs to make sense, but we would encourage folks not to skimp. If you need furniture and playground equipment and some sort of operational support as you staff up and then get your building full, think comprehensively about what that looks like and submit a full request.
Thank you.
Thank you, Maritas.
Emily, you have a question?
Yeah, so mine kind of pertains, you had talked about the transformational elements, what qualifies and how, like in Johnson, it might mean that like you're kind of hoping for something like, 100 seats are opened up kind of thing. What about for people like family childcare providers that, maybe they want to do something outside of their own personal home, but that means they're going basically from their family license to their group license, and they're at best going to be adding 6 spots. Does that eliminate them from this type of accelerator grant?
It doesn't eliminate it. That certainly you'd meet the threshold. I think it comes as this goes through a review process, and it's going to have outside reviewers on it. I think I want to be realistic about what I think the most competitive applications are going to be based on your community type. But you would certainly meet that threshold for submitting an application, Emily. Yeah.
Because it would, like, if you were looking at the percentage of what I'm trying to increase, it's a significant percentage
Sure.
For my license. Okay. All right. That makes sense. Thank you.
Thank you, Emily.
Lucas,
Lucas, I
this is
didn't have-
Hannah White. I just wanted to restate
Go
something
ahead.
that I heard you say that I thought was very meaningful. So if I'm hearing you correctly, any award could be transformational based on the needs of that community. So transformational could be, 3 or 4 spots, depending on what the needs of that community are. Is that what I'm hearing?
Yeah, based on community need and looking at things like the child care aware numbers. Yeah.
Okay.
And Lucas, just another question. So really you're looking for, one entity that may, for example, in Emily's community, there may be a coalition of providers that could be a combination of home and centers applying together, or is it one organization applying for their needs based off of a community?
So we would not be looking for applicants with subgrantees.
Okay.
We know that there are some folks that are looking at putting together applications where, for example, a community foundation is considering acting as the fiscal agent and basically carrying out the entire project. And that is okay, but if what you're really looking at is setting up a situation where you would have subgrantees, that isn't how we've set up the grant.
Okay. Perfect. Thank you for clarifying. Any other questions? Next, we have Jarvis, and Jarvis is going to talk about the child care licensing regulatory review update.
Thank you, Cornelia. Hope everybody's doing well today. I'm glad it's Friday. It's been for me, been a pretty crazy week with everything going on. But yeah, I just want to give you all some updates on what we have going on with the regulation review process that we have going on. So many of you may have heard about what we have going on, reviewing our statutes and regulations. This is actually, we initiated the review last week, actually. We're going to start by doing 2-hour meetings twice a week. So through the Children's Cabinet, DCF, and KDSE, we were able to get funding to support us in some additional capacity. We've had a lot of turnover over the past few years, and we got a lot of new faces within licensing. So we're really excited and grateful to be having some people come on and help us. Many of you may know, I don't know how long some of you have been around, but I know since I've been around, I've heard a lot about Mary Murphy. So she's started with us last week. So she's helping us get going, kind of doing some preliminary things, getting the groundwork laid. And then also Jean Luger is going to be also assisting us later in the process. A little bit more about the scope of our review. It's going to be grounded in Lexi's law legislation. that's always going to be important around what we do. And of course, the Child Care Development Block Grant reauthorization. And we want to make sure we're meeting those federal guidelines and that we're able to be continue to be federally funded. We're also going to be looking at state fire codes and national fire codes. We want to make sure we stay as close as we can with national health and safety standards. Then also we want to make sure we're looking at comparing ourselves to neighboring states, seeing what they're doing. We don't want to reinvent the wheel, but also we want to make sure we are our own, but there may be things that we can take into consideration to make changes as well. So let's see here. We want to make sure we hit some areas of importance, and those include our general regulations, which touch multiple program types. So that's going to be something for us that we feel that we hit those, that we can get that in one fell swoop. Our licensed daycare homes and group daycare homes, and our child care centers and preschools, school age programs and drop-in programs. We're looking at prioritizing our regs to touch on the federal requirements first, and then as well as system priorities, and then we want also get workforce input. There are some non-regulatory areas and solutions we want to dive into in relations to micro centers, and then also our small center pilot that we're looking at. As I mentioned before, a bit about Mary and Jean, they're going to be back to help us, but we also want to make sure we're going to be utilizing our system improvement team. They're going to act as an advisory role for going through the process. But then also we're going to utilize our partners in the regulated community in some instances where we feel that's appropriate, and we want to make sure we get that feedback as well. So we're going to be putting out things from time to time, maybe a timeline that we're going to post things so people have a chance to weigh in on some of the regulations we're looking at. Our timeline, like I said, we began last week. So coming up in April, what we're looking at is to review a full list of the regulations and the revisions we want to make, and then prioritize those by category. We're going to look at doing a phase 1 of our changes in between May and July. I'm going to draft some recommended changes and revisions. July to September, we're looking at phase 2 and drafting revisions to statutes and regulations. And then September to November, we want to try to get these things through agency concurrence process and get moving on those, get them drafted and signed and put through. So that's what that looks like. So as we go through, we're going to make sure we keep everyone abreast of what we're doing. We're looking at doing updates periodically so everyone knows where we are. So with that, I stand for questions if anybody has any.
Any questions for Jarvis? If none, well, thank you, Jarvis, for sharing the update. Exciting to see what revisions or changes or enhancements or whatnot will happen to, statutes and regulations or whatnot. And so thank you for the hard work. I know that's going to be quite the task, and going through everything. And so thank you again for doing that. So next I'm going to share an update, really just a quick update, in terms of the Early Childhood Government Summit that we had on February the 17th. We had 13 different groups who supported and who shared information about the programs and services that are provided to children and families across the state. And it was amazing to be able to hear about the successes and the good work that we do in Kansas. It was, you think, okay, we have 13 different people, and is that going to be like a really, really heavy taxing conversation or whatnot? But really, it was nice to know that, we all have our different meetings and the work, with the work that we're doing, but we put it all together. We're making good strides in terms of the work that we're doing across the state, and we're working together well, and it was really nice to be able to see, that type of, of connection, and also, again, to see all of the successes, that were made within the organizations. There is a graphic recording that was made by Sarah O'Keefe. And if you've not had a chance to be able to see her work before, please go on ahead and look at the summary of events and the graphic recording on the Kansas Children's Cabinet website. She did a really great job of documenting the successes, that were shared by everyone, the goals that people have, plans, moving forward, and really putting it in a way I think that really captured and expressed what everybody was trying to share. So for everyone who was able to attend, thank you for being there. For everyone who presented, we really appreciate hearing your updates, and please go on ahead and check it out because we are doing some great things in Kansas. Next, we are going to, Lindsay, myself, and Chavis will be talking about the work group structure. And as we mentioned, before, I can think in January, we talked about the fact that our work groups were going to look a little bit different, as we kind of started our new year. And so, Lindsay, I'm going to pass it on to you first, as we just kind of make sure that we talk about maybe the difference of our work group and what the expectations will be going forward.
Great. Thanks, Cornelia. Many of you have received lots of reminders and communication from me over the past couple of months. Earlier this week, I sent out your sort of group of information for the group that you selected, and we were able to put everybody in the first group of their choice. Although there's some variances in the size of the groups, I feel like we have a really good mix of people spread throughout the groups, and hopefully we'll see some great movement going forward. So the goal for these work groups is to spend the next 3 months to develop potentially recommendations or next steps tied to tactics from the All In for Kansas Kids strategic plan. All of the information that I sent you by email and more is available on the panel SharePoint hub. So you're sort of like a closed network resource place. So all of the orientation information, the resource documents. A couple of the groups have already started emailing additional resources. I've placed those in the files as well. If you ever want a quick walkthrough or orientation to that SharePoint hub, reach out to me. I'm happy to walk you through it and make sure that you can navigate to all of those places. But if you click on the link, which you all have in your email and is also available here, you can open that up, and all the tactic work groups have their own page with all of the information and files. So you can upload notes, you can add additional resources to the folders. As you're working to collaborate on files, you can use that space together. So that should be a nice resource as you work over the next few months. The outcomes or next steps could be a formal recommendation to the Children's Cabinet based on your tactic, but it doesn't have to be a formal recommendation, especially thinking about some of the work that the groups are looking at. There may be many steps along the way before you get to, and if that is even appropriate, to have some type of formal recommendation. Could be delegation or connection to another governance group within the state. It could just be action plans or sort of, lists of information. So the outcomes are really up to you. And it doesn't have to be that sort of formal recommendation as a next step. We know that work happens in the system in a lot of different ways, and this certainly falls into that as well. As a next step, as far as after you begin meeting, at the following meeting, so for after today, our next meeting will be in April. A portion of our full panel meeting will be set aside for each work group to share updates about what they've been working on, ask questions, get input or feedback from the full panel if that's needed. But we'll have you, instead of reporting back today, we'll have you report back. You'll certainly have some time after our meeting today to begin meeting, but there may be additional work that happens within your group over the next month. So we'll have you report back at that next panel meeting, and we will hold time for that. So one of the things that you'll need to do is make sure that you have some type of update ready and someone to give that to the group as well. As far as the timeline, again, we're going to hold time after each panel meeting for March, April, and May. Again, you can set up additional time. If you need any help coordinating space for that, virtual space, reach out to me. Happy to help create a Zoom link or whatever might be helpful for you as your group continues to work. And then the goal is that by your last panel meeting for this current term on June 16th, that we would have some type of outcome or next step, whether that's a formal recommendation or started documentation, whatever it may be. So that's sort of our general timeline and process. I'm going to turn it over to Cornelia to give any updates or thoughts about the groups as you get started. And then I'll have my colleague Chavis join us as well, who works at CPPR and really did a lot of the work to create those starting resource documents that have a lot of good links and documents and all the different things to help inform some of the work that you're doing.
Very good, Maria, thank you. And so as you can see here on this slide, we have our work groups that are identified. Each of you have already been assigned to work groups. And if you haven't been assigned to one, feel free to just hop on a work group that's of your interest. And if I'm like taking somebody else's script or line, you're supposed to say, I'm sorry, Lindsay. And so please hop on on a work group that you're interested in, and they'll make sure that they add you to that group's roster. One of the things that we really wanted to point out is that there may be a lot of cross-pollination or opportunities where you have very similar discussions as we talk about things in our work groups. And so first with strategy 4.2, we're promoting family-friendly workplaces through public and private sectors. So we're good there, and that's clear. When we get to developing recommendations to increase compensation and benefits, that may go hand in hand with documenting and addressing recruitment and retention challenges, because those of us in the industry know that part of the reason where maybe we struggle in recruiting and retaining our employees is because of compensation and benefits. And so, not the only reason, but that is definitely one of the things. And so as you are focusing on your tactic and the things that your group is assigned to, please stay very focused on initiatives that aren't also addressed in a different group if possible. Because we don't want is group 6.11 and group 6.15 talking about the same thing. Because if that's the case, we might as well combine the two, because I think initially the plan was to have those two work groups as one work group, but there was I think there was a discussion or a request to actually break it into two groups. And so, there's definite, benefits for both models. But if we both end up landing on the same compensation and benefits conversation, then I don't know that that's the best use of everybody's time, right? Because we're all talking about the same thing. And so, are there other things besides compensation and benefits that impact recruitment and retention? And we know there are. And so let's focus on those, because I think it's going to strengthen the recommendations, that we give as we are all, kind of thinking like not so much outside of the box from a larger scope. And then the local zoning and homeowner associations, talking about that, we've already heard, one thing that probably may be something that can be addressed that Hannah mentioned, as maybe one of the challenges that may be impacted. This may be part of why, certain things can't be mentioned, or whatnot, and should that be addressed. And so, I think it's going to be a great opportunity for us to really hone in. We may not have concrete recommendations. It may be just active discussions, where we're getting a chance to hear from, everybody that has a passion or an interest in these tactic areas, where then we can take the notes, the conversations, et cetera, back to the people who are making the decisions, to be able to see what kind of recommendations or changes, enhancements or whatnot can come based off of these discussions. But if we do have recommendations, that's great, because that's part of, our role is, as people who are in the trenches and doing the work, what can we recommend, for the state going forward as we move to enhance, the quality of care and education for children and families. So there is, to get started, well, Lindsay, what can I pass this over to you?
Absolutely. I just sort of wanted to invite my colleague Chavis to join us today, who really did a lot of the heavy lifting to put together those starting resource documents. So I thought I might have Chavis just sort of do a quick reminder about what's included in those. And then if you've had a chance to review or had any questions, we wanted to make sure that both Cornelia and Chavis and I were available before your groups get started today to help answer any questions that you might have. So anyway, I just wanted to give credit and bring Chavis to the group today. She's been really amazing. So welcome.
Thank you, Lindsay. Good morning, everyone. I'm happy to see you all and meet you all for the first time. My name is Chavis. I'm a research project coordinator with the Center for Public Partnerships and Research, and I am here to provide some support in the background. What you have to get you started in your work groups is a resource document, as well as just some tips for best practices when engaging in this kind of task force work. Everything that's included in those resources is very foundational and really intended to either orient you to the topic if it's new to you, or get conversations started within your group. So very much geared towards just a starting point for the work that you're about to engage in. Please know, though, that if you find as you're progressing that you need more specific information or data, or would like to really find some other resources that are drilling down into what you're discussing, then I'm here to provide that support. So you'll reach out to Lindsay because you have her contact information, but she may delegate some of that support to me as well. So I'm happy to see you all, happy to let you see my face so you can put it along with the name if you get connected with me. That's all I have to share today, and I'm happy to answer any questions you might have about those initial documents that you have to get started.
Okay, perfect. Well, thank you again, Chavis, for all that you've done in putting all of this together, coordinating our efforts. This is 1 second. We're having a.
Cornelia, I think Lindsay got kicked off. She said she'll be right back.
Yeah, I saw that. Yeah.
Sorry for the interruption. My Zoom
You're
has
good.
been problematic recently, so apologies. Please continue.
Okay. Mine is updated like 3 times already. So yes, yes. So again, Chavis, thank you for for your work in putting all of this together and giving us the information that we need to at least lead and guide instruction. The tactic work groups will look different than they did before, but I think it'll be exciting to be able to see how it all comes together. So thank you for that. Next, we're going to have an update from Carolyn Ireland from DCF, who is going to talk about the early child education shared resources.
Yes, hello. Public speaking is not my forte, so I apologize. I'm just going to introduce myself real quick. I've only been on one of these meetings before. I'm Caroline Ireland. I'm the Links to Quality Developmental Specialist with DCF. I've been here coming up about 9 months. Prior to this, I was a teacher working with young children for about 10 years, which is why I'm so passionate about what we're talking about today. So we are talking about ECE Resources Kansas, which is a website with a plethora of resources for the ECE world in one place. This is both for teachers and providers. I'll go through many resource examples today, but there wouldn't be enough time to go through the whole website and all the resources as well. So, all right. So these are how the resources are categorized and available by topic. They go by subtopics as well and then get into specifics. So going through engaging families in the classroom, saving money, successful program management, and Kansas specific resources. Basically, these topics give the providers the best, well-rounded overview of how to run their business. This also gives the teachers resources on some lessons and ways to get families involved. Okay, so this section regarding engaging families has resources available to help build positive and communicable relationships among families, providers, and staff. So all about getting the families involved, which is very important, especially we're all in the ECE world, so we all know that. All right. So these are just some of the examples. I mean, once you're on the website, there's so many resources, but just giving some examples, cultural responsiveness, child development, education, and social and emotional, just in the engaging family section. So this resource is an example. It gives a tip sheet on how to raise empathetic children, easily printable for the teachers and providers, just kind of giving a little bit of examples and specifics of this section. The next one, this is the cultural responsiveness resource. It has a Head Start resource that can all be downloaded or downloaded by individual chapters. So the access is so easy for the teachers. All right, so in the classroom section, our aim is to provide providers and teachers with a wealth of practical resources that can be incorporated into the classroom. So the goal is to offer easily accessible and printable materials that simplify their work and enhance their experience in childcare. So here are more examples for the in the classroom resources: assessment, curriculum, literacy, physical activity. This resource has not only printables, but this is a video on specific ways to assess children. I know that was a big one when I was a teacher that I felt is awesome to be able to not only print out, but also see the videos. That's just how the way I learn. And so not just giving one way of teaching or different resources, but also those different ways people learn. This is probably the most helpful resource for teachers, in my opinion. The book list of age-appropriate books for teachers in the classroom. I was really excited as a former teacher to see this one for them. Okay, so the idea for the saving money section is to do exactly that. It's to save the provider and teachers money. This is done by showing local and national opportunities to cut costs in childcare. Personally, I'm not a business person, so this would have been really helpful for me as a provider or teacher. All right, so the saving money resource examples, local vendors, where to get started, calculating savings and saving programs. I think that's probably the most helpful, the where to get started, the starting a business. That's not a lot of times everyone's forte in childcare. And so just that overwhelming sense of like, what do I do first? Okay, so here's an example. So just calculating the savings, so helpful ways to that providers specifically can save money. And then the list of many vendors to help out with saving money and getting great discounts for the teachers and providers. All right, so the successful program management portion of the ECE Resources Kansas website helps providers to make their childcare business as successful as possible. So from trainings, tax information, insurance, quality are just a few of the resources available at the providers and teachers' fingertips. The different examples are the forms, the templates, the reducing risk, the policies, the business and strategic plans, the compliance and policy. This is a very helpful tool for the teachers specifically. I remember making all of my lessons when I was a teacher, and that was so time consuming. So just having like daily reports for send home, IEP request forms, things that they don't necessarily need to spend their time on. It's just right there. And then I had to put all the forms in here. So again, checklists, plans, forms, etc., that don't have to be made, that they don't have to spend their time on. And some more information, telehealth, it's a very low cost, both for their teachers and providers' mental and physical health. And the HR hotline just got added, and it's a low cost of $300 per year. So the HR hotline answers questions about liability and risk, and is kind of at the fingertips of the providers. All right, so we are in the process of building our Kansas specific resources. The idea for the Kansas specific section will be to help providers and teachers with finding local resources that can help their classroom and business, as well as support our local community partners. So if you have any information that you would like to share with me that you believe should be on the ECE Resources Kansas website, I would be happy to look at whatever links you send or whatever information you send. I specifically have already shared some national information as well with them, and they've put that on their site. So any resources you see, I know that they're always taking for the national and for the Kansas as we're building.
Well, thank you, Caroline, for sharing. It is a great resource to have. You know, I mean, you're right. There's so much that's on here where we don't have to reinvent the wheel. It's already there, right? And especially in helping new providers or even experienced providers, sometimes just seeing a different way of doing things or how to enhance what you're doing is, you know, always helpful. Does anybody have any questions for Caroline?
And I don't want to forget that it was not just DCF that has done this. We had so many partners like Child Care Aware of Kansas, like the Kansas Child Care Training Opportunities, Kansas Department of Health and Environment, KU Center for Public Relations, Public Partnership and Research.
This is Maritas. I have a question. Is this resources, does this include a little bit of information about special education?
It should, and I can, if you send me your email, I can send you the for sure yes or no, because there's so many resources. I'm just getting told that yes, it does.
Thank you. Thank you.
That's good. Any other questions? No, well, very good. Well, I am certainly looking forward to thumbing through all of this and, you know, and seeing, you know, just analyzing even further, you know, what's out there. And so thank you again for sharing. Next, we have Marie from CAME, who is going to talk about the infant mental health endorsement.
Okay. Well, Marie is on the call, but my name is Lana Messner, and I work with the Kansas Association for Infant and Early Childhood Mental Health as a program manager alongside Marie Trico. Beth Bluebot, Association Coordinator for CAME, is also with us on this call, and hopefully between the three of us, we'll be able to answer any questions that you have after our presentation. So today, what we plan to share about the Kansas Association for Infant and Early Childhood Mental Health is what we do, what the infant mental health endorsement is, and talk about reflective supervision. We'd also like to summarize what we've been able to accomplish with the preschool development funding, and we'd also like to invite you to our annual conference in Wichita. And then we'll leave a little time at the end to wrap up by answering any questions that you might have. So CAME's mission is to advance the field of infant and early childhood mental health. We're an association of professionals in Kansas who are passionate about spreading awareness of the mental health needs of infants, toddlers, and their families, and the people who care for them. So CAME is a not-for-profit association focused on supporting the mental health of infants, toddlers, and their families, and CAME does this through several approaches. We promote and advocate for public policies to destigmatize and advance the importance of mental health for infants, young children, their families, and the professionals who support them. And we accomplish this through state and national partnerships, communication strategies, including new website with resources and information about infant and early childhood mental health, as well as an active social media presence. CAME also offers an international credential called an infant mental health endorsement for professionals in the field to recognize their skills, their knowledge, and their experience. Beth is going to share a lot more about the endorsement shortly. But finally, CAME offers professional development opportunities, including an annual conference, reflective supervision training, and regular webinars. CAME also provides information and scholarships to support utilization of professional development from associations and organizations who offer training on infant and early childhood mental health. We definitely do not want to reinvent the wheel. There are so many organizations across Kansas who are already providing this valuable training. Next slide.
Hi, so I'm Beth, and I'm going to talk over the next few slides, but the full name of the CAME endorsement is the Endorsement for Culturally Sensitive, Relationship-Focused Practice Promoting Infant and Early Childhood Mental Health. We call it the Infant Mental Health Endorsement. Endorsement is internationally recognized credential for professionals working with or on behalf of pregnant women, infants, very young children, and their families. It was created to recognize and document the development of infant and early childhood and family professionals. It's a verifiable process based on competency areas that recognize specialized training, acquired knowledge, reflective supervision consultation, and work experiences for all professionals in the infant and early childhood and family field. Endorsement is cross-sector, it's multidisciplinary, includes professionals from child, human development, education, nursing, pediatrics, psychiatry, psychology, social work, and many others. And endorsement indicates an individual's professional efforts to specialize in the promotion and the practice of infant and early childhood mental health within their own chosen discipline and their scope of practice. Next slide. With our current climate and focus on mental health needs of children and families, endorsement is a really good fit for funders and other programs who are interested in ensuring the professionals who serve young children and families have the expertise that they need to do the work. Endorsement was designed to be cross-disciplinary. For example, early care and education professionals who work in child care centers, family child care settings, mental health professionals, decision makers at the state level, lactation consultants can all hold an infant mental health endorsement through CAME. Endorsement is focused on those professionals who are engaged in the work of supporting infants, toddlers, young children, and their families' mental health. It's a strategy to recognize training, experience, and expertise of those professionals who are doing the work. If we go to the next slide, we can talk about how endorsement was developed. It started by a Michigan Association for Infant Mental Health. And now that has grown into an international association called the Alliance for the Advancement of Infant Mental Health. This is a group of professionals grounded in best practice. Kansas is a member of this international alliance and is currently one of 34 US states and 4 international associations who offer this credential. And so this speaks to reciprocity. Of course, we don't want anyone to leave Kansas. But if they happen to, their endorsement that they've earned here in Kansas will be recognized across these other alliance states and those international associations. The same for if somebody moves from those states or international associations to Kansas, it's recognized. So internationally, there's currently 5,296 endorsed professionals and 2,700 in process. And then at the end of 22, Kansas had over 131 professionals and then 74 in process. We go to the next slide. Endorsement is a reflection of Kansas' commitment to best practices in infant and family field, which encompasses a wide range of professionals. This is an exciting time of great growth in Kansas and across our nation. We do this through the membership with the Alliance for the Advancement of Infant Mental Health, which we just talked a little bit about. And CAME does this specifically by recognizing a person's education, training, and work experience specific to supporting mental health of infants and toddlers. Our endorsement verifies that someone's attained a specific level of functioning and understanding about the promotion of infant mental health and provides a level of assurance to families, coworkers, organizations, and the larger community that the person who provides the services to the infants and their families meets a set of standards that support the optimal development of that child. We call these set of standards the competency guidelines. We purchased the license for these guidelines so that we could uniquely support our infant mental health workforce across the state. Only state infant mental health associations can purchase the competency and sponsor the endorsement. We also want to point out that endorsement is specific to work with or on behalf of children ages 0 to 3 and their families. An endorsement, it's like the credential, like the CDA. And with additional funding from the Department for Children and Families, CAME has been able to intentionally reach out to our early childhood education community to bring awareness and remove barriers like cost of membership and fees that are related to endorsement. So we're really excited about that. Next slide. There we go. An endorsement is a professional development strategy. So when a professional who is in the early childhood field starts the process of endorsement, they're asked to reflect on what they know and how they know it. Building the online application to demonstrate that they've met all the competencies is a powerful self-examination. Endorsement is acknowledgement that includes our frontline care workers that do relationship-based, culturally sensitive care. They support early childhood mental health in their daily practice. So these are some of the comments from the professionals who have attained endorsement. I'll highlight them a little bit because I know that font's kind of small. It's held the professional to a higher standard. Being endorsed means that you're able to educate families better on infant mental health. Another one said having a grounding and being knowledgeable in infant mental health changed the way they work. Felt like a 180-degree turn. Going through the process refreshed their thinking and re-inspired their work. The next one is with endorsement, it guarantees you have a certain amount of experience, training, and education and reflective supervision, and you're held to these competencies. And the last one is, I have noticed the shift that the endorsement has had in the workforce. People are taking it seriously and using it to plan their professional development and seek out additional skills. It is such an important support for us. Next slide. So we have several categories of endorsement that is really tailored to the scope and practice of the professional. So it recognizes paid work experience prenatally through 36 months and recognizes professionals whose paid work experience has been primarily with this age group and their families. There's no hierarchy to these categories. One is not more important or less important than the other. Each category includes content areas particular to this defined competency. So it's really individually specialized categories. Endorsement recognizes professionals that work with or on behalf of children and families who advocate through promotion, prevention, and intervention. And the next slide shows how those might look in career pathways. So there's multiple pathways for professionals. And endorsement recognizes the participation and experiences that lead to competence. And it acknowledges a professional's choice to specialize in infant and early childhood mental health. All of the categories recognize those who work with infant mental health principles in mind, and all categories are applicable to many disciplines. The possible disciplines or types of work that one may do with the corresponding category of endorsement, we kind of outlined here in these. So the promotion path is generally early care and education providers, but that doesn't mean it has to be them exclusively. Prevention and early intervention path is typically our more broad category. So it's been a really good fit for our home visitors who provide support and education to families, infants, and toddlers. Like Nurse Family Partnership, Healthy Families America, Parents as Teachers, Early Head Start, and other early interventionists. The next pathway in the middle is a new pathway that we've just started this year that the Alliance is excited about, as well as Kansas. It's for prevention and early intervention supervisors, for professionals who provide the reflective supervision for other professionals. So applicants need a minimum of 2 years of providing prevention and early intervention services, as well as some supervision. So it's a support category for some of our other categories. And then the treatment intervention pathway is for those that are engaged in infant mental health practice, those that provide relationship-based therapies to address the ghosts in the nurseries. Our specialists come from many disciplines, so occupational therapy, education, social work, human development, psychology. Most of them are licensed mental health providers, but not all of them. And then the final pathway is the leadership pathway, and that is divided into 3 subcategories. So we have a clinical for those who provide reflective supervision, consultation, and clinical services. There's policy for our leaders who are in policy and program design, program administration. And then our research faculty is for those that are in academic settings or conducting research that promotes infant mental health or teaching about the principles and practices. We go to the next slide. These are the competency areas that I was referencing in the previous slides. So that these competencies were formed in Michigan back in 1997 to identify which early intervention competencies specific to infant mental health. The group was comprised of experts in the infant mental health field, including practitioners, program supervisors, university and faculty, and policy experts. And they represented many disciplines, including social work, early childhood, psychology, special education, child and family development, and nursing. After about 3 years of this group meeting, they had concluded through their extensive field research that these 8 areas were areas of expertise. So each of our endorsement categories that I talked about previously include all of these competencies. It varies a little bit depending on the applicant's scope of work, but the applicant is required to demonstrate a varying amount of in-depth work in each of these competency areas. And this begins the movement to consistency for all of the applicants to define what expertise in infant mental health really is using these 8 competencies. When reviewing the competency guidelines and how these competencies fall within each area of expertise, we ask the applicants to really think about their body of work, including their education and their experience. And then they complete an online application that shows how their work meets this criteria in each of these 8 competency areas. And that's really the beginning of how they build their own application and reflect on the work and specialized training and experiences that they have and bring to this field. So the 8 competencies, in case you can't read the print, is theoretical foundations, law, regulation, agency policy, systems expertise, direct service skills, working with others, communicating, thinking, and reflection. And so now we're on to reflective supervision consultation. So I will pass that back to Lana, but thank you.
Thanks, Beth. So reflective supervision is a requirement for several categories of endorsement. And reflective supervision and consultation kind of goes beyond like managerial supervision, for example, with home visitors or teachers in a child care center, or clinical supervision for mental health professionals. Reflective supervision is a shared exploration with attention to all of the relationships. So that includes the relationship between the early childhood educator or a home visitor and the parent or the caregiver, between the caregiver and the baby, and between the practitioner and the supervisor. So it's really important to understand how each of these relationships affects the others. The impact the practitioner has on their professional work is at the heart of reflective supervision. And more important, by attending to the emotional content of the work and how reactions to the content affect the work, reflective supervision or consultation is a strategy to build professional and personal development. Recently, a professional who just started reflective supervision said, "I was thinking of starting to see a counselor to manage my stress at work and at home. But after starting reflective supervision, I don't really feel like I have to anymore." To us, that is just incredibly powerful. And what that statement tells me is that she felt supported enough by reflective supervision at work to allow her to better manage her stress outside of work. Since she had reflective supervision to support the challenges she had at work, she kind of had more bandwidth to deal with life outside of work. And to me, that's really a retention strategy for people in the field, right? So this, a little bit more about reflective supervision. It is a professional development model for frontline workers like educators, social workers, healthcare professionals, and early intervention specialists. Reflective supervision consultation involves regularly scheduled sessions, either one-on-one or in a group. These conversations take place between a trained reflective supervisor or consultant and a staff and member or individual participants. During reflective supervision sessions, practitioners can share their thoughts and feelings about their work. Being on the front lines with families who are experiencing challenging problems can be very stressful, and sometimes that's referred to as vicarious trauma. So reflective supervision, research is currently being conducted to determine how reflective supervision may mediate that vicarious trauma, burnout, and stress, and really strengthen families through more effective services. For example, reflective supervision helps frontline workers manage their stress and increase their effectiveness through what the Reflective Practice Center at the University of Minnesota has termed the 4 R's. Release. Reflective supervision provides an outlet for participants to voice concerns and frustrations that arise at work. Reframe. Reflective supervision provides a safe context within which participants can ask themselves questions, consider multiple perspectives, and unpack their own biases. It helps to refocus. Reflective supervision helps practitioners identify how they feel they can have the greatest impact. They can also come up with new strategies to try. Participants report approaching their work with greater flexibility rather than a fixed agenda in their response. They're better able to nurture trusting relationships with families after having reflective supervision. Next slide, please. Reflective supervision is not new to the early childhood field. Reflective supervision has been required by many programs such as home visiting and early childhood education. But to meet the endorsement criteria, the National Alliance has very specific requirements for the provision of reflective supervision, which leads to the endorsement credential. Professionals who have attained endorsement at the categories you see on this slide can offer reflective supervision after they have attended training on best practices established by the National Alliance for Infant Mental Health. When a facilitator conducts group reflective supervision, it takes very specific skills and acquired knowledge of the group process. So CAME offers training to professionals who are interested in offering reflective supervision that meets that national criteria. Currently, 8 individuals are nearing the end of an 18-month reflective supervision collaborative to complete the requirement. CAME is very interested in building capacity for reflective supervision across the state by recruiting professionals who are interested in offering reflective supervision for their staffs in-house and would like to offer additional reflective supervision training collaboratives. To clarify the difference between supervision and consultation, reflective supervision is when an in-house staff person provides reflective supervision. Reflective consultation is when a professional is hired to provide reflective supervision from outside an organization, such as a consultant. Individuals and agencies who might offer to seek in-house reflective supervision include home visiting program supervisors, early childhood education coaches, early childhood education directors, mental health professionals, and others who supervise staff who work with or on behalf of infants and toddlers. CAME is well aware of the need for reflective supervision to support individuals who are Black, Indigenous, or people of color, or BIPOC, in the early childhood education field. To meet this need, CAME is establishing a reflective supervision group for BIPOC professionals and will be offering professional development opportunities that are specific to the needs of the BIPOC population. Next slide. Currently, CAME is supporting 15 reflective supervision groups across Kansas. And the essential components of reflective supervision include regularity, establishing consistent and predictable meeting dates and times, and really making that reflective supervision a protected space and make it valued as for its own time. Secondly, collaboration. It's really forming a trusting relationship between the supervisor and the practitioner. The supervisor does not have all the answers in this model, but acknowledges that the professional is the expert in the family, on the family or the child. The reflective supervision works alongside the early childhood professional to find their own solutions to the challenges that they face that are unique to each family or child. And finally, the big idea for professional relationships to be effective, the early childhood educator must have the support to explore and reflect on themselves and what they bring to their work. To accomplish this level of reflection, the supervisor or consultant might do things like during a reflective supervision consultation, ask questions that encourage details about the infant, parent, and the emerging relationship. They spend a bit of time really listening, exploring the parallel process or what the professional brings to the relationship, and allowing time for personal reflection, remaining emotionally present, teaching and guiding, nurturing and supporting, integrating emotion and reason, and fostering the reflective process to be internalized by the supervisee, and finally, attend to how the relations to the content affect the reflective process. In other words, reflective supervision is the ability to use emotional responses as data, and that takes training, right? When a facilitator conducts group reflective supervision, can we go back a slide? It takes skill and acquired knowledge of the group process. So CAME offers training to professionals who are interested in offering reflective supervision that meets the national criteria. For more information about upcoming training for reflective supervisors, please contact CAME. As you were talking earlier about the tactic groups, reflective supervision consultation could support tactic 6.1.5 to address retention challenges. It's really a place for people to bring that vicarious trauma or to bring their challenges in a way that doesn't feel like, if I bring this challenge to my supervisor, am I not going to get that raise that I need next year, right? So it's a safe place for people to bring some of the challenges that they face in working with very young children and families. Okay, next slide. So CAME is seeking support and funding to expand infant and early childhood mental health as a critical support system for early care and education professionals to prevent burnout, increase job satisfaction, and build protective factors for families. CAME is seeking to expand training opportunities to build capacity for organizations to offer reflective supervision in-house, and the overall number of qualified professionals who can offer reflective supervision to meet the nationally recognized endorsement requirements. CAME is also seeking to accomplish this task infrastructure. To accomplish this task, infrastructure is needed to coordinate, manage, and build partnerships with early childhood professionals across the state. CAME currently owns the infant mental health endorsement, but receives many requests each year from professionals who serve preschool-age children and their families to become endorsed as an early childhood mental health professional. So CAME is really interested in seeking additional support and funding to purchase and staff the early childhood mental health endorsement. CAME works actively with state-level partners and to embed the endorsement system in Kansas. So in other states, endorsement is often used as a tool for recognizing higher quality of services and thus higher reimbursement rates for childcare providers, mental health professionals, special education providers, and more. There are several statewide organizations who provide higher raises for staff who have attained the endorsement. So this could be something that tactic 6.1.1 could be used to increase compensation. We'd also like other states also have included the endorsement in their career pathway documents and have embedded them in the quality rating systems in various states. So those are all strategies that could be done in Kansas. Next slide, please. So with the preschool development funding for the past 3 years, CAME has been able to support more than 48 professionals to earn their endorsement, and currently 73 additional people are working on their portfolios and applications. We were able to offer an 18-month learning collaborative, and it's nearing its completion. And we have 15 reflective supervision groups, not 12. We just added 3 more so folks across the state can participate in reflective supervision. We've offered expanded professional development opportunities, including our annual conference and a fall learning series, and very specific training to diversity, equity, inclusion, and access. We've updated the CAME website and established stronger communication through social media presence and newsletters. CAME is also very proud of stronger relationships with statewide partners, including the Division for Children and Families, Kansas Child Care Training Opportunities, Kansas Children's Service League, Healthy Families, specifically Healthy Families America, Kansas State University, Emporia State University, Kansas Parents as Teachers Association, Kansas Breastfeeding Coalition, Kansas Pyramid Collaborative, and many others. Next, we'd like to invite you to the CANE Annual Conference, which will be held in Wichita, April 27th and 28th. On the keynote speaker on Thursday will be Allie Tickton, excuse me, who will present Understanding the Sensory System and its Importance in Early Childhood Development and Social Emotional Regulation. Allie began her work in pediatric development at the University of Michigan, where she earned her BS in movement science and continued her studies at USC, where she received her Master's of Arts and clinical doctorate in occupational therapy. Allie is a certified certified in sensory integration. On Friday morning, Dr. George Thompson will present Who Decides If I'm Safe? Polyvagal Theory in Infant Mental Health. So Dr. Thompson is a child psychiatrist and clinical associate professor of psychiatry at both the University of Kansas and the University of Missouri, Kansas City Schools of Medicine. Dr. Thompson is devoted to assisting families and healthcare organizations build emotionally safe, curious, and collaborative cultures that transform trauma into wisdom. Friday afternoon, we'll also have several breakout sessions, including supporting infants and toddlers in the foster care system, the benefits of reflective supervision, LGBTQIA, cultural competency, and best practices for working with LGBTQIA youth and families, and so much more. So we're very curious to find out if we could have a brief conversation about how you think your staffs might benefit from the endorsement and/or reflective supervision. And also answer any questions that you have about the endorsement.
Emily?
Hi, Emily Barnes. I think this is amazing. I had already been contemplating going to the conference at the end of April, but had been trying to figure out the logistics on, could I close for that many more days? And the presentation you gave is, yes, this is totally worth it, 100%. Where my brain was going to when you were talking about like the difference between like the supervision and consultation, I am a board member for Child Care Provider Coalition of Kansas. And one of the things, none of us really are in-house. We are all our own entities. However, would something like a coalition where we all have the same goals, same professional orientation here, could that count as an in-house, or would that still be along the lines of consultation? Because one of the things that many providers are asking for is the ability to provide or receive mentorship, peer mentorship, and actually have a plan in place that not only gives, clock hours and, benefits to the person receiving the mentorship, but to the person who has now done it. And that's a professional development element to them too. And so how does that look like if we had members of the workforce qualified to provide the supervision or consultation? How does that work?
And you're talking specifically about family child care providers?
Mm-hmm. Yeah.
Okay. So we are, CAME has just contracted with a qualified reflective supervisor to start a virtual reflective supervision group with family child care providers. So if you're interested in joining that group and want to learn more about it, the only requirements that we have currently, because of the support that we've received from the Division for Children and Families, is that you apply for endorsement and pay the membership fee of $35. So we can
agreed.
So we are able to waive all of the fees associated with getting your endorsement. And at this time, we're able to also pay for the reflective supervision. So the group size is limited to 6 people. But if you're interested, please contact Beth at beth@came.org, and we'll get you signed up for a reflective supervision group.
took a picture of the screen. So
Great.
well,
And that group will meet for 2 hours a month for a year. So we're thrilled to have you, Emily.
Maritas, I believe I saw your hand up, but then it went away. Do you have a question?
Yes, this is Maritas. I'm not sure if this has been discussed, but how long is the endorsement process or period, and what is the cost of endorsement?
So currently, if you work with or on behalf of early childhood programs, all of the fees for application fees are waived, and we can find a reflective supervision group for you so that you can complete the requirements. So currently, we're thrilled to say there is no charge. And the fees that are associated with each category of the endorsement vary depending on which category. So there isn't like a flat fee. The only expenditure that we're asking people to participate at this time is for the $35 fee for membership in CAME.
Thank you.
I think another question that Marita's had was about the length of time that it takes to get endorsed. So Beth or Lana, speak on that.
Yep,
Yeah.
I just unmuted. I was going to circle back to that. And the answer is it really depends. So as long as you have met all of the requirements for some of the categories require reflective supervision. And so once you've gotten all of those hours, they vary from 35 to 50. And depending on how much training and education hours you've already had depends on the category. So some people already have it when they come to us, and it's just a matter of how long it takes them to fill out the paperwork. And others need to pick up a few more trainings and are just beginning. So it really just depends on how much you already have under your belt before you start the process.
Thank you.
So this is Cornelia at Top Early Learning Centers. We're in the process of making a culture change of becoming a trauma-sensitive school. And so we have, behavior specialists that support our children and our staff or whatnot. And I can definitely see this being something that we need to integrate into our work that would kind of be in alignment with what we're trying to do to support our children, with majority of them being at risk. There's a lot of social emotional struggles, with our children. Not that that's only limited to children who are at risk, but there's just a lot. Our kids have a lot going on, and so it's I could definitely see how bringing in this endorsement, offering this to our team, would be beneficial to everyone.
Cornelia, if you want to reach out to us specifically, we can sort of help you develop a plan around how to, if there are specific strategies that we can help you with regarding reflective supervision for either the behavior specialists or the classroom teachers. Maybe help them, the behavior specialists, with some training about how to do reflective supervision, and help them get endorsed so that any of your teachers would be able to use that. There's a lot of ways that we can help you.
Okay, perfect. Thank you.
Mm-hmm.
Any other questions? If none, thank you all for sharing information. I think that, we, again, always pleased to see all that we have available to support the work that's happening for our children and our families across the state. And so this was really helpful information to receive. So thank you.
Well, thank you for giving us the opportunity to come and share.
Of course. So as we begin to wrap up, first thing we want to do is talk about the agenda items for April through June. So as you know, each month we try to bring bring topics that we think would be of interest and of value to our panel members, but also to the state, to those viewers or whatnot. And we wanted to maybe pick your brains and see whether or not you had any specific areas or specific agenda items that you would like to see added, topics that you'd like to learn more about, anything that was presented in the past that you would like an update on, or anything like that. If you could provide some direction, we want to make sure that what we're bringing to the table is something of interest to you. And so we wanted to hear from you in terms of what you would like to learn more about or what you would like to have added to the agenda. So does anybody have any items, suggestions, recommendations, anything like that? And if it's like, okay, she just threw this question at me, so I don't know, I have to think about it, right, and process. And so I totally get that. And I haven't had my morning coffee. And so I'm really not gonna, so there you go. And so there is a agenda resource form that is available on the panel SharePoint hub. And Lindsay sent the link out to that. And so if in fact you become aware of something that's happening that you think would be good information to share with the panel, please fill out that form because then what we'll do is go on ahead and follow up and try to coordinate, find speakers or whatnot to come and share information about whatever that item is. And so again, that resource agenda and resource form is on the SharePoint hub. And so please use it, at your leisure, just so that, again, we make sure that we're bringing forth the information that you want to learn more about. Applications for the 23-24 year for our recommendations panel will be available in April, and they are due May the 5th. Again, as we apply to become members of the recommendations panel, it is a one-year term. So we do have to reapply. We hope that you are all interested in reapplying and that you will also share this with others because we definitely want to bring more people, to the table if possible. And so again, please remember that the application is due on May the 5th, but it will be available in April. It looks pretty much the same as it did before, so there's no change or anything to the application itself. But again, May 5th is the deadline. Next, we have bright spots. Do we have any bright spots that we would like to share?
This is Tanya Bullock. I have something that happened this week that we've been working on, I feel like over a year, but we've been working with the city of Wichita because they have a stricter ordinance than KDHE when it comes to family childcare programs. They don't allow group licensing in family childcare programs. So we've been working through various committees and posing it to all of them. And it went to the commissioners Tuesday, and they passed it. So the ordinance will, I guess it's not official until it's in the news. So it's unofficial right now, but I was there, it passed. So we finally made that change, but it did take a long time and a lot of advocates and people to help us. So very proud of that. Because that is a safe change that we're making.
There you go. There you go. Well done. Congratulations on that. I know a lot of work went into that. So very good. Eldana?
Oh, hello. So yeah, Johnson County had their Communities in Action meeting a couple weeks ago, and we had quite a good turnout and many people that have said they're very interested in helping to put the Child Care Coalition together for Johnson County. So I think that's a real bright spot for our county.
Very good. Hannah?
Oh my gosh, this is Hannah White. Sorry, that was way quicker than I thought. Just a shout out to all of the members here that were at the Core Competencies Workday yesterday. Linda Logan and that group have done a fantastic job. So we started the adaptations yesterday and had a full workday, and it was super productive, but just really excited about how that work is going. And many of the members of the panel today were there yesterday. So just really, really great work happening. And again, shout out to Linda and team for pulling that all together.
Very good. Maritas?
This is an invitation to all of you. If you're looking to visit Kansas City, Kansas anytime soon, we do have a preschool open house or enrichment at the Kansas State School for the Blind on April 14th from 3 to 6. If you have any questions, please email me. Thank you.
Very good, very good. Any other bright spots?
Hi, this is Dominique Lewis. I am in the Kansas City area. And yesterday I had the opportunity to participate. There was like a community conference hosted by Junior League here in Kansas City. And I think it's really easy, especially when we're thinking about all the challenges that early childhood programs are facing. It's really, you can kind of get caught in the stress of it all. And I'm just really excited because I saw during the conference lots of like interagency partnerships that kind of, that people made connections, really kind of channeling in on this, how do I get businesses that have nothing to do with childcare to understand that these obstacles in early childhood impact the whole community. And just the dialogue and connections that were made just really kind of motivated me to be a little more optimistic. It was really good conversation.
Very good, very good. Thank you for sharing. Any other bright spots? And if none, for our upcoming meetings, we will have the Kansas Children's Cabinet and Trust Fund meeting on Friday, April the 14th from 9 to 12. And then we have our next Early Child Recommendations panel on Friday, April the 21st from 9 to 11:30. And so go on ahead and mark your calendars for both of those if you've not already done so. So this will be, again, a reminder, a little bit different in terms of how we've managed our breakout groups or whatnot in the past. So we're going to adjourn. I'm going to give you about 5 minutes or so just to fill up your coffee cups and kind of get yourself settled and ready to then go over to your tactic work groups. And so your tactic groups will have until 11:30 to meet. And I think that Lindsay, will you be assigning people to their groups? We won't have links. You'll be moving people elsewhere. Is that how that's going to work?
It'll all be in this space. And when we come back to open up those rooms, I'll open the breakout rooms and you can click on the room that matches your group that you selected.
Perfect, perfect. And so it is 10:35. And so let's go on ahead and return at 10:40. We're about 5 minutes earlier. Do you want to just do 10:45, Lindsay? What do you think? 10:45. Let's give you. We'll give you 5 more minutes. And so 10:45. So 10:45. Go ahead and come back. You'll again be at this link, and then we'll go on ahead and join our tactic work groups. Thank you all for again for the conversation, for questions, comments, or whatever, and again for your time and support of the work that's happening across the state for Kansas children and families. We will not be reporting back after our work groups, and so you all have a wonderful weekend and look forward to seeing you next month.